Conventional and resin-modified glass ionomer restoratives offer numerous benefits to restored tooth structure. They react with dentin and enamel to form a strong chemical bond and release fluoride for extended periods of time. When the fluoride level drops, the glass ionomer can absorb fluoride from topical fluoride treatment and release it again. As a result, glass ionomers are considered to have an antichoriogenic effect. Glass ionomers also release other ions, such as strontium and phosphate, to help remineralize teeth. SDI North America Incorporated, a global leader in direct restorative dental products, is proud to introduce Riva Self-Cure and Riva Light Cure, two of SDI's flagship glass ionomer restorative materials. Containing proprietary ion glass technology, Riva Self-Cure and Riva Light Cure are state-of-the-art glass ionomer restoratives with the added benefit of improved aesthetics and greater fluoride release. Riva Self-Cure is a conventional glass ionomer restorative used mainly as a dentin replacement. Additionally, it may be used in small Class 1 and 2 restorations, restorations for geriatric patients, especially for root caries, cervical erosion, and Class 5 restorations, intermediate restorative and base material for Class 1 and 2 restorations using the sandwich technique, which will be discussed later in this module, core buildups, temporary fillings, and abfraction lesions. Riva Light Cure is a light-cured, resin-modified glass ionomer restorative material. It has all the advantages of a true glass ionomer with the aesthetic, lifelike look of a composite. Riva Light Cure can be used for the same clinical indications as Riva Self-Cure with the addition of pit and fissure sealing and as a liner. Recent studies have shown that when using Riva Light Cure and Self-Cure as a base under composite restorative materials, compared to using a flowable composite, Riva demonstrated the least microleakage, primarily due to its ability to donate ions to the tooth and reduce shrinkage stress. Riva products contain proprietary glass filler called ion glass. SDI ion glass is a radiopaque reactive glass that releases high amounts of phosphate, fluoride, and strontium ions to assist in remineralizing teeth. Immediately following the placement of the glass ionomer, a ferment of chemical activity takes place under the restorative. Available minerals from the dentin mix with the ions released from Riva, creating a free ion exchange that continues until the acid is buffered by the phosphate ions. As the pH rises, the cement restorative sets and the ion exchange slows down. It has been shown that strontium, fluoride, and phosphate ions from the Riva can penetrate a considerable distance into partially demineralized dentin, aiding in its repair. Let's first discuss using Riva Self-Cure and Riva Light Cure as standalone restoratives in non-stress-bearing areas, and then under composites in high-stress-bearing areas using the sandwich technique. After preparing the cavity site, apply Riva conditioner for 10 seconds or super etch 37% phosphoric acid for 5 seconds to optimize adhesion. Wash the tooth thoroughly, then remove the excess water, keeping the tooth slightly moist. Push in the Riva Self-Cure capsule plunger and mix in a triturator for 10 seconds. Insert the capsule into the Riva applicator 2 and click the applicator 3 times. On the 4th click, apply the material directly into the cavity and contour the material as needed. After the material has initially set, apply a layer of Riva Coat and Light Cure for 20 seconds. Applying Riva Coat at this early stage before finishing assists in preventing the material from moisture uptake during the setting period and ensures the glass ionomer cement sets with optimum mechanical properties. Final finishing can begin 4.5 minutes after the start of mixing for fast set and 6 minutes after start of mixing for regular set. To complete the restoration, apply Riva Coat again and light cure. This will protect the restoration from dehydration and water absorption in the first 24 hours after placement. When using Riva Light Cure as a final restoration, prepare the tooth as previously described. Apply in increments up to 2 millimeters and light cure each increment for 20 seconds. Final finishing can begin immediately after light curing. The addition of Riva Coat is not necessary when using Riva Light Cure. The popular sandwich technique involves placing a glass ionomer as a base and then capping it with a composite. Conservatively prepare the cavity site and apply Riva conditioner for 10 seconds or super etch 37% phosphoric acid for 5 seconds to optimize adhesion. Wash the tooth thoroughly, remove the excess water, and keep the tooth slightly moist. Place Riva Self-Cure up to the dentin enamel junction. Riva Self-Cure Fast Set will completely set in 4.5 minutes and the regular sets in 6 minutes. Using Super Etch 37% phosphoric acid, etch the cavity walls and the existing Riva Self-Cure for 5 seconds. Then wash and dry with oil-free air. Brush a bonding agent such as Stay from SDI over the etched enamel and GIC surface. Dry gently to evaporate the solvent and light cure for 10 seconds. Place a resin composite such as ice from SDI in increments of up to 2 millimeters, light curing each increment for at least 20 seconds. Contour and finish. Riva Self-Cure and Riva Light Cure are available in popular Vita shades, in capsules or powder liquid kits. Glass ionomers have dramatically changed in recent years. They are the optimal material for preventing caries and remineralizing tooth structure. Effective and simple to use, Riva Self-Cure and Riva Light Cure directly bond to tooth structure. They are strong, provide great sealing ability, and they are an excellent source of fluoride. Glass ionomers make it easy for you to practice minimally invasive dentistry and play an important role in caries management. If you are looking for a state-of-the-art glass ionomer, choose Riva Self-Cure and Riva Light Cure from SDI North America Incorporated.